A research group has projected future health care impacts in South Dakota from the recently passed Big Beautiful Bill. Dakota Territory's Blake Trolley spoke with the group, who says thousands will ultimately be affected.
KFF's analysis has found that an additional 12,000 people in South Dakota will likely be uninsured in 2034 compared to if the bill had not passed.
The distinction is nuanced, but we're not saying 12,000 people are going to suddenly lose their health insurance coverage. We're saying once everything's fully in effect, once everything's been implemented, in the year 2034, an additional 12,000 people will be uninsured relative to what we would have expected if the law hadn't passed.
According to KFF, the largest source of newly uninsured people will come from work requirements being added to Medicaid. KFF's Alice Burns points to paperwork challenges as a major factor in those losses. She says some won't submit the right paperwork to begin with, and others will lose their coverage from not doing the ongoing paperwork correctly.
States will have some flexibility with how often they require people to submit this paperwork, but some may need to do it at least once a month. And again, there may be cases where people's data are automatically matched and it's not a huge deal, but if it's not automatically matched and you have to submit all the required paperwork, that's a pretty big burden for people to report. Particularly those who may be in the gig economy, working multiple jobs, or people who qualify for an exemption because they're in school, because they have a disability, or meet the requirement through volunteering hours.
The study found that the Big Beautiful Bill, in conjunction with the expiration of ACA enhanced tax credits, will likely lead to 20,000 additional uninsured people in South Dakota by 2034. Both numbers have a 25% variability, accounting for uncertainty in how individual states will implement the work requirements. Furthermore, KFF found that the number of uninsured could be even larger because of an additional rule that is yet to be accounted for. Last week, Senate Majority Leader John Thune told Dakota Territory News that the changes from the bill will not affect people who qualified for Medicaid before its expansion.
Elderly Americans, low-income elderly Americans, pregnant moms, the disabled, those are all people that are covered under traditional Medicaid. They're not going to be impacted by this.
In Rapid City, Blake Trolley, Dakota Territory News.